What if you walked into a pharmacy in an English-speaking country right now, and you had no idea what to say? The pharmacist is looking at you, waiting, and the words just disappear from your head. That is exactly what today's episode is going to fix. Welcome to Next Level English. I am your host, Maya, and today we are going to make sure you never feel lost at the pharmacy again.
And I am Tom. Maya, I have to be honest with you. The first time I went to a pharmacy in the United States, I stood there for a full minute just pointing at my throat. Not my best moment.
Tom, you did not.
I absolutely did. I had no idea how to describe what I needed, and I did not know any of the phrases. So if anyone listening to this has ever felt that same panic, you are in the right place today.
Completely. And that is why this episode is so important. We're going to go through real vocabulary, real chunks, and real sentences that English speakers actually use at the pharmacy every single day. Not textbook language, real, natural, everyday English.
Let us start from the very beginning. When you walk into a pharmacy, the first thing you might hear is the pharmacist saying something to you. Maya, what do they usually say?
Great starting point. So, the most common thing a pharmacist will say when you walk up to the counter is, "How can I help you today?" Or, "What can I do for you?" Now, listen to that second one again. What can I do for you? This is a very natural, friendly chunk that native speakers use all the time, not just at the pharmacy, but in shops, in offices, everywhere. What can I do for you? Say it with me in your head. What can I do for you?
And your response, this is where a lot of learners freeze. You want something, but you're not sure how to begin. The best chunk to start your sentence is, I'm looking for something for, and then you say your problem. For example, I'm looking for something for a headache, or I'm looking for something for a sore throat.
I'm looking for something for a headache. I'm looking for something for a cold. I'm looking for something for allergies. Tom, that structure is so useful because it works in so many situations. You do not need to know the name of the medicine. You just describe the problem and the pharmacist takes care of the rest.
Exactly. And this is the beauty of learning chunks instead of individual words. A chunk is a group of words that belong together. They work as one unit. I'm looking for something for is a chunk. You just drop your problem at the end and you are done.
Now let's talk about describing symptoms, because sometimes the pharmacist will ask you, "What seems to be the problem?" or "What are your symptoms?" And you need to know how to describe how you feel. Here are some key phrases. I've been feeling is a great one. I've been feeling really run down lately. Run down, that means tired, weak, like your body has no energy.
Run down. That's a great vocabulary word. I've been feeling run down. And another one that comes up a lot is, I have a stuffy nose. Stuffy, not blocked, not closed, stuffy. That's the word English speakers use naturally, a stuffy nose.
A stuffy nose. And related to that, you might say, my nose is running. A runny nose or a runny nose, both are used. I have a runny nose. So we have stuffy nose and runny nose. Two different feelings, two different words. Stuffy means blocked and full. Runny means liquid coming out. Very different things, but both very common at the pharmacy.
And what about pain? How do you describe pain in English?
This is such an important area. So there are different kinds of pain, and English has specific words for each. You have a dull ache. That's a pain that is there all the time, but not very sharp. I have a dull ache in my lower back. Then you have a sharp pain that's sudden and intense. I have a sharp pain when I swallow. And then you have a throbbing pain. Throbbing means it comes and goes, like a pulse. I have a throbbing headache.
Dull ache, sharp pain, throbbing pain. Those three are the main ones. And the pharmacist will often ask you, on a scale of 1 to 10, how would you rate the pain? That's a very common phrase in English-speaking countries. They want to know how serious it is.
On a scale of 1 to 10, that's another chunk worth remembering. And your answer might be, I would say about a 6, or it's pretty bad, maybe a 7 or 8.
Now, let's move into one of the most important vocabulary areas for the pharmacy, the difference between prescription medicine and over-the-counter medicine. These two terms come up constantly.
Yes, prescription medicine means the doctor has to write you a note, called a prescription, before you can buy the medicine. Over-the-counter medicine is medicine you can buy freely without a prescription. You just pick it up from the shelf. Is this available over the counter? That's a very important question.
Is this available over the counter? Say it again. Is this available over the counter? That one sentence can save you a lot of confusion because sometimes you go to the pharmacy looking for something and you don't know if you need a doctor first or not.
And if you already have a prescription from the doctor, you would say, I would like to fill a prescription. Fill a prescription. Fill a prescription. That's the chunk. Not collect, not get. Fill. I'm here to fill a prescription. The pharmacist will then take your paper or check your name in the system and prepare the medicine for you.
Fill a prescription. That's one of those chunks that sounds strange if you translate it literally into another language. But in English, that's just how it's said. Fill a prescription.
And while you're waiting, you might hear the pharmacist say, it will be ready in about 15 minutes, or we will have that ready for you shortly. Shortly means in a little while, not a specific time, just soon.
There is another situation at the pharmacy that I want to talk about, and that is when you're buying medicine and you want to understand how to take it. Because the pharmacist might explain the dosage to you and you need to understand every word.
Dosage is the word for how much medicine to take and how often. The pharmacist might say, take 2 tablets 3 times a day with food. Let us break that down. 2 tablets 3 times a day with food. With food is very important because some medicines can hurt your stomach if you take them without eating first.
And sometimes they say, do not take more than the recommended dose. Recommended dose. That means the amount that is safe and suggested. Do not take more. Do not take more than the recommended dose.
Another thing you will often hear is, take 1 tablet every 4 to 6 hours as needed. As needed means only when you feel the pain or the symptom, not on a fixed schedule, only when you actually need it. As needed.
As needed. That is a really useful phrase. Take as needed. It gives you the freedom to decide. And the opposite of as needed is take regularly. Regularly means on a fixed schedule, every day, whether you feel the symptom or not.
Now I want to teach you some very useful chunks for when you are not sure about something, because sometimes the pharmacist explains things and you do not fully understand, and it is completely okay to ask for clarification. A great phrase is, could you say that again, please? Or even more natural, sorry, could you repeat that?
Could you repeat that? And if you want them to speak more slowly, you say, could you speak a little more slowly, please? English speakers will never think less of you for asking that. They appreciate it, actually.
Absolutely. And another phrase that is incredibly useful, not just at the pharmacy, but everywhere, is just to make sure I understand correctly, and then you repeat back what they said in your own words. Just to make sure I understand correctly, I take 1 in the morning and 1 at night. That shows the pharmacist you are being careful, and they will confirm or correct you.
Just to make sure I understand correctly. That is a fantastic chunk. Let us say it one more time. Just to make sure I understand correctly. Use that everywhere. It's polite, it's clear, and it gets you the information you need.
Now, let us talk about some common over-the-counter medicines and their English names. Because when you walk into a pharmacy, you want to be able to read those labels and understand what you are looking at.
Pain relievers. That's the category for medicines that reduce pain. Paracetamol or acetaminophen, ibuprofen, aspirin. These are all pain relievers. I'm looking for a pain reliever for my headache is something you could say directly.
And then there are antihistamines. This is the medicine for allergies. If your eyes are watering and you are sneezing and you feel itchy, you probably need an antihistamine. Do you have any antihistamines? Is a perfectly natural question.
Antihistamines. And then decongestants. Those are for a blocked or stuffy nose. Decongestants help you breathe more easily. I need something for congestion. Congestion, that's when your nose or chest feels blocked and heavy.
Cough syrup. Everyone knows a cough, but the medicine for it is called cough syrup. It comes in a bottle and you drink a spoonful. Do you have anything for a dry cough? Dry cough means there is no mucus. You are just coughing and it's scratchy and irritating.
And a wet cough or a chesty cough means there's mucus and you're coughing things up. The pharmacist will ask you which type you have because the medicine is different for each one.
Dry cough or wet cough, chesty cough. Those distinctions really matter. A good chunk to remember is, I've had this cough for about a week and it doesn't seem to be getting better. Doesn't seem to be getting better. That phrase tells the pharmacist the problem is lasting a while and you need real help.
Doesn't seem to be getting better. And the opposite is it's starting to clear up, which means you're improving. Starting to clear up.
Let us now talk about a situation that requires a little more sensitivity. What if you are at the pharmacy and you need to ask about side effects? Side effects are the unwanted things a medicine can do to your body apart from helping you.
Side effects. And the natural way to ask is, are there any side effects I should know about? Are there any side effects I should know about? The pharmacist might say things like, this medicine can cause drowsiness. Drowsiness means feeling sleepy. Don't drive while taking this medicine.
Don't drive while taking this medicine. That is a very serious instruction. And another common one is avoid alcohol while taking this. Avoid alcohol. Avoid means stay away from, do not use.
So you want to remember these three: drowsiness, avoid alcohol, don't drive. Those three come up again and again with many common medicines.
And if you are taking other medicines already, you should always say, I'm currently taking, and then name the other medicine. Is it safe to take this with what I'm already taking? Is it safe to take this with what I'm already taking? That is a very responsible and very natural sentence.
Is it safe to take this with what I'm already taking? Important. Some medicines cannot be taken together. They react with each other, and that can be dangerous.
Let's do a quick review of the most important chunks and vocabulary from today. Are you ready?
Let's go.
What can I do for you? That's what the pharmacist says. I'm looking for something for a headache. That's how you ask for help. I'm looking for something for a sore throat. I'm looking for something for. Fill in the blank. That chunk is your best friend at the pharmacy.
And for describing how you feel, I've been feeling run down. I have a stuffy nose. I have a runny nose. I have a dull ache. I have a sharp pain. I have a throbbing headache. Real vocabulary, real feelings, described in real English.
And for the medicine itself, is this available over the counter? I would like to fill a prescription. Take 2 tablets 3 times a day with food. Take as needed. Do not take more than the recommended dose.
And for understanding and communicating, could you repeat that? Could you speak a little more slowly, please? Just to make sure I understand correctly. Are there any side effects I should know about? Is it safe to take this with what I'm already taking?
When you put all of these together, you are not just surviving at the pharmacy, you're communicating like a confident English speaker.
And remember, the pharmacist is there to help you. They deal with people all day. They're patient. They want you to understand. So do not be afraid to say, could you repeat that? Or just to make sure I understand correctly. Those phrases show maturity in the language, not weakness.
Maturity in the language. I love that way of putting it, Tom.
It's true, though. Beginners think asking questions makes them look bad, but confident learners know that asking the right question is a skill.
Absolutely. And that's what Next Level English is all about. Not just memorizing words, understanding how to use them, when to use them, and feeling comfortable using them in real life.
If this episode helped you, share it with one friend who's learning English. Just one, because when you share what you learn, it sticks even better in your own memory.
And leave us a comment telling us what situation you want to learn English for next. The airport, a job interview, a restaurant? We want to hear from you.
Until next time, keep going, keep practicing. And remember, every conversation you have in English is one step closer to the next level.
This is Maya.
And this is Tom.
From Next Level English. We'll see you in the next episode. Take care of yourself.